Living with schizophrenia or bipolar I disorder can present unique challenges, and finding the right treatment is a crucial part of managing your health. What if a newer option could offer relief, but also required careful consideration? Today, we're going to talk about Bysanti, pronounced Bysanti, a medication recently approved by the FDA on February 20th, 2026. Bysanti, also known by its generic name Milsaperidone, is an oral tablet designed to help adults manage schizophrenia and the acute manic or mixed episodes associated with bipolar I disorder. You take it twice daily. To ensure Bysanti works best for you, your healthcare provider might suggest a genetic test before you start. This test helps understand how your body processes the medication, as some people process it slowly and might need a different dosing schedule. While experts aren't fully certain how it works, Bysanti is an atypical antipsychotic that appears to block certain brain receptors, offering a new pathway for treatment. It comes in various strengths, from 1 to 12 milligrams. Like all medications, Bysanti has potential side effects. For those with schizophrenia, common ones include dizziness, dry mouth, feeling tired or sleepy, a stuffy nose, feeling faint when standing quickly, a racing heartbeat, and weight gain. In bipolar I disorder, you might experience a racing heartbeat, dizziness, dry mouth, an increase in liver enzymes, stuffy nose, weight gain, low blood pressure, or feeling unusually tired. It's worth noting that in studies, patients on Bysanti gained an average of 6 to 7 pounds more than those on a placebo. Always talk to your doctor about any symptoms you experience. Now, it's very important to understand some serious warnings. Bysanti carries a boxed warning about its risk in elderly patients with dementia-related psychosis. For these individuals, antipsychotic medications, including Bysanti, can increase the risk of death. Bysanti is not approved for use in people with dementia-related psychosis. Beyond that, Bysanti can cause serious side effects like allergic reactions, including rapid swelling. There's also a reported increased risk of stroke in elderly people with dementia-related psychosis. Heart rhythm changes can occur, which can be serious, so tell your doctor if you have any heart problems and seek immediate help for faintness or irregular heartbeats. Watch out for symptoms like very high fever and rigid muscles, which could signal a rare but life-threatening condition called neuroleptic malignant syndrome. Uncontrollable body movements, known as tardive dyskinesia, can also happen and might become permanent. Metabolic changes, including high blood sugar, cholesterol, and weight gain, are possible, so your doctor will monitor these. You might also experience lightheadedness from a sudden drop in blood pressure, especially when starting or changing your dose, increasing your risk of falls. Other potential concerns include seizures, a decrease in infection-fighting white blood cells, increased prolactin levels, difficulty regulating body temperature, swallowing problems, or, for males, a painful, prolonged erection. Bysanti can also affect your judgment, so be careful with activities like driving until you know how it affects you. If you have upcoming eye surgery, be sure to inform your doctor if you're taking Bysanti. Before starting Bysanti, ensure your doctor knows about all your medical conditions, especially liver issues or a history of low white blood cell count. Discuss all medications and supplements you're taking, as some can interact with Bysanti, potentially requiring a lower dose. If you are pregnant or breastfeeding, specific risks and guidelines apply, and you should not breastfeed while on Bysanti. You should avoid alcohol, overheating, dehydration, and suddenly standing up quickly while taking this medication. The key takeaway is that Bysanti offers a new treatment avenue for schizophrenia and bipolar I disorder, but it requires careful monitoring and open communication with your healthcare provider. Understanding both its benefits and potential risks is essential for a safe and effective treatment plan. For more detailed information and to ensure this applies to your specific situation, always consult your healthcare provider.